If you've gone to the doctor thinking you were covered by insurance and then received another bill in the mail weeks later, John Franchini, Superintendent of Insurance in New Mexico, says you're not alone.
We know that 35% of all the medical bills in this country are sent out with higher than expected costs in the billings. So it's a very common problem. And very few people respond and try to ask about it. We're here to tell the people they can ask about it and they can get their bills lowered.
Franchini says one of the most common places this happens is in emergency rooms. When you see a doctor who contracts with the hospital but isn't licensed with your health maintenance carrier.
I usually go to an emergency room and they have a copay and a deductible. So they pay it and then they come back and they think they're done with their health maintenance plan and they find out that they get a bill for $2,000 over what they paid. And most of them say, well, that must be what I owe. It isn't what they owe. It's extra billing.
Franchini says some bills like this can be extreme, like one couple in Albuquerque that was rushed to the hospital to have an emergency delivery of triplets.
That couple ended up getting a $3.5 million bill for their care. And ultimately, after we helped them and we went back to the institutions that were charging these bills, they paid $25,000 for their copay and $1,000 for their deductible, and the rest was paid for by the hospitals and the doctors involved in the operations.
Franchini says if you are confused by a medical bill, try calling your doctor or insurance company. And if you don't like the answer, you can call the Superintendent of Insurance.
We're here to help them solve that. They can call the Department of Insurance and ask for managed health care, and our managed health care department is designed to help people with this very problem.
For more information, you can go online to osi.state.nm.us. For KRWG, I'm Samantha Sonner.